Well, good afternoon, everybody, and welcome to the Community Pharmacy More Profit Roundtable. This is the mini version of a hour-long program that I offer once a month. But every week we get together for about 25 minutes to cover some highlights of the More Profit Roundtable. So I call this the mini roundtable. My name is Breck Rice. I'll be your host this afternoon. It's been my pleasure to host this program, and also my privilege to work with community pharmacies for more than 20 years. Everything that I do, I look to bypass the PBMs and help community pharmacies make and keep more profit. And so that's what this program is all about: is helping community pharmacies again bypass the PBMs and make more profit. So one of the other podcasts that I do is the PBM Reform podcast on the Pharmacy Podcast Network. Try to make any positive changes I can there against the PBM and insurance mafia. That is a really slow process, but we are chiseling away at that big iceberg that is the PBMs, and making every change that we can. But again, it is a slow process and it will never be completely reformed. And so that's why I offer the Community Pharmacy More Profit Roundtable series. Our title sponsor, RX One Shop, where they do the shopping for you, find all the great deals, and help you save. So I want to thank them as our title sponsor. But we have got some very important information to share with you this afternoon. They're like everything that I do does bypass the PBMs to help you, including my own company. So I am the co-founder of ServeRx. ServeRx is a third-party payer that again bypasses the PBMs to help you get the fair reimbursements you deserve. This chart right here just shows you some of the common medications that are prescribed for injured workers. Our program is to help community pharmacies serve those injured workers without any hassle, delays, or out-of-pocket expense. And it's a mitigating your risk too. You could just go ahead and take care of those patients, send the claim to our bin, and we will pay you in 30 days, whether we collect or not. So it's a really wonderful program. That's why every PSAO in the country has us as their preferred provider. And you're probably already contracted with us through your PSAO. So if you're not using this program, we encourage you to get enrolled with us. I'll leave some information in the show notes of how to contact us if you aren't enrolled yet. I'm a firm believer that community pharmacies need to look beyond just dispensing. You know, back 15, 20 years ago, it was quite profitable to just dispense medications. You know, profit margins were 30, 35%. Today, you're lucky if you're getting 3 to 5% on dispensing medications. And so I'm a firm believer that you should have about 1/3 of your revenue coming from non-dispensing sources. And so that's why I provide this program, is to look at some solutions that might work for your pharmacy. A lot of community pharmacies are now looking into trying to get into more clinical services. I can assure you there's more wrong ways to do that than right ways. In the last couple of years, I've seen a lot of pharmacy friends of mine spend thousands and thousands of dollars and still not get across the finish line. So we want to help provide a roadmap for you so that you can do this successfully. So some of the things I'm going to be talking about today do focus on the clinical side of things. On the hour-long podcast that happens every second Wednesday of the month, we get into front-end products, but today we're going to really look at some clinical solutions for you. I've outlined a 3-step process here for successfully doing clinical, and it starts with remote therapeutic monitoring. This is a tremendous opportunity for community pharmacies. In fact, the first time that a remote care program could be offered through a community pharmacy. Most of the remote care programs really were designed for the physicians to check in with their patients in between office visits. But this remote therapeutic monitoring is a way for a community pharmacy to get involved, and I'll share more details on that. here in just a moment. The second step is the full medical billing for additional clinical services. This network, the Independent Pharmacy Provider Network, helps community pharmacies really capitalize on services you might already be doing, but you're missing out on the medical billing aspect of this. So, for instance, flu shots. It's flu season, everyone is getting their flu shot. Well, IPPN can turn a a $20-$40 immunization into an $85 preventative health visit because you're now able to bill on the medical side. I'll highlight and just touch on that program a bit. And then step 3 is the full brick and mortar clinic in your pharmacy. This won't be a solution for every community pharmacy because you do have to have the room for it. You're going to need a footprint of about 10 by 12 square feet. You're going to need to have the capital to be able to bring in some of the equipment that's needed for that. But I will just touch on some of the benefits of that for you here as well in the program today. You can always do step 1 completely independent, never take step 2 and step 3. You just can't do step 3 without step 2. Step 2, the prerequisite for doing the full brick and mortar HIPAA compliant clinical room is being in network with IPPN, because they do the collaboration agreements with the doctors. They get you set up so that you are in the medical networks, etc. So without any further delay, let's jump into this low-hanging fruit for community pharmacies in remote care solutions. And if you look back at the history of CPT codes that were approved by CMS, the first CPT code was chronic care management, the CCM, clear back in 2014, 2015 timeframe. Again, really focused at the physicians to be able to offer that to their patients. The same with remote physiological monitoring. I always called it remote patient monitoring, or RPM. Again, that came onto the scene to help physicians check in with their patients in between appointments. That came on about 2019. And those two programs, CCM and RPM, really the PCP is directing those programs. So there wasn't really a way for community pharmacy to get involved without a lot of extra steps, a lot of hassle of getting credentialed or getting collaborating providers to work with you, etc. But the new kid on the block, the remote therapeutic monitoring, is an opportunity for community pharmacies to get involved and offer a solution to your patients that they're all looking for when we talk about the senior patient population specifically. All seniors are concerned about fall prevention. They want to keep their memories. They want to keep good balance. This program is clinically proven in order to be able to do those, take care of those top concerns, plus a lot of other things as well. Now, it is, again, like I said, the first time that this has been offered through community pharmacies, and there's no startup costs. That's one of the beautiful things about the RTM program, is all the heavy lifting is going to be done by a company called Remote Care Today, and there is no cost to the pharmacy to set up this program and start offering it to their senior patient population. Now, Medicare is really pushing this out because they want to help patients. They finally have seen the light that an ounce of prevention is worth a pound of cure, and so they're really backing this. And let's look at some of the conditions that are covered. It's mainly musculoskeletal disorders, but also respiratory issues and some medication management. In the center column there, you'll see the symptoms that are covered. Very broad symptoms: pain, stiffness, weakness. So it's really easy to qualify the patient, or for the patient to qualify for this program. And then again, the improved outcomes, improving cognitive plasticity, mobility, motion, etc. Again, addressing the two top concerns that seniors have: loss of memory and loss of balance. Now, When we look at what Medicare is currently spending on addressing just falls today, it's over $50 billion now, billion with a B. They project that that's going to increase to over 100 billion in the next 5 years. Cognitive impairment really does uh, contribute to falls. There's a statistic there that you see that patients with dementia increase their fall rate by 300%. Along with the cognitive side, you've got seniors in your 70s and 80s that about 2/3 of them are experiencing some kind of cognitive decline. And now, almost every minute, someone is diagnosed with Alzheimer's disease. And the program that you'll be able to offer to your senior patient population, this RTM program, has been clinically proven to delay or prevent dementia in your patients by up to 8 years. In fact, one of the studies that I really like, the statistic isn't shown here, but if a senior is involved in a remote therapeutic monitoring program, they are 75% less likely to contract dementia. So I want to share just a 2-minute explanation of the platform, which is called Brain Health Plus for memory, balance, and cognition, that is being offered through the remote care today. So this 2 minutes can explain this comprehensive program a lot better than I can.
As an independent pharmacist, you already know your patients count on you. And with reimbursement challenges and tight margins, finding new revenue streams that actually help your patients is more important than ever. That's why we're happy to introduce you to Brain Health Plus, a remote therapeutic monitoring program, RTM, covered by Medicare Part B and most Medicare Advantage plans, designed to improve memory, balance, and cognitive function in just 5 to 10 minutes a day. It does this with fun exercises and games that stimulate the brain, increasing neuroplasticity. Your patients can access Brain Health Plus from their smartphone, tablet, or computer. It's a one of a kind RTM platform that offers engaging, fun, and clinically proven activities to improve cognitive health, prevent falls, and helps your senior patients stay independent longer. We're talking about daily brain games, interactive motion sensing exercises, motivational health content, medication management tools like being able to scan your medicines right into the system, reminders of when to take medicines, potential drug to drug interactions, and even geofencing alerts so loved ones are notified if a patient visits the ER or hospital. Every patient also gets a 30-second biometric facial scan they can do at home so they can scan their face and track their health as often as they wish. This amazing technology lets them track important health vitals like blood pressure, heart rate, and oxygen levels with 96% accuracy. Done with a smartphone or even a computer, it keeps patients motivated and engaged without replacing their medical care. And here's the best part, we do it all for you. You get a fully turnkey solution, flyers, posters, bag stuffers, and patient onboarding handled entirely by us. We even do all the Medicare billing. No added staff time, no upfront cost. In fact, no cost to you ever. Just real results for your patients, such as a clinically proven decrease in falls and better memory. And you can earn administrative service fees for simply reviewing monthly patient progress reports for each participating patient, which will significantly add additional profits to your bottom line. Brain Health Plus, easy for you, powerful for your patients, and great for your pharmacy. Click the book a call button to schedule a demo and bring it to your pharmacy today.
So as you can see, very comprehensive program. One of the features I really love is that geofencing, where loved ones can be notified if a senior ends up at the emergency room. Also that bioscanning technology. I played around with that. It is incredibly accurate. It's not to replace an actual, blood pressure cuff, but it's a good baseline for patients. You'll have access to that too as well at your pharmacy, just as a patient engagement tool. As you can see here, and it was explained in the explainer video, it is covered by Medicare Part B. Don't stress; you don't have to be credentialed. Most pharmacies are not, credentialed for Part B. You're just Part D. But don't worry about that because that is all covered by remote care today. All their providers are in network nationwide with Part B, and also most Advantage plans will cover it as well. I do want to share one testimonial with you. This is an 89-year-old gentleman by the name of Paul. He admits that he hates to exercise, but he'll do this program, which is exercising. So it's Ludafit is just one of the tools in the toolbox here for Brain Health Plus. It does have a lot of clinical studies already done on this particular tool and the benefits and the outcomes, about 8 different independent studies. And a version of Ludafit is already being used in over 500 rehabilitation centers nationwide. You'll have access to offer this program to your senior patient population. And again, at no cost to you, your patients will have access to this. But let me show you Paul's testimonial real quick.
My name is Paul Charney. I live in Tucson, Arizona. I just turned 89 years old, and I hate to exercise. When I had the opportunity to try Ludafit, I found it fun. I enjoy it. I enjoy it because it's a game, and psychologically, I know that it's benefiting me. You move, and the avatar, that is a figure that represents you on the screen, it moves along with you. And it's fun. You hear the shushing of the skis through the snow, and you see obstacles in front of you. You try to avoid the obstacles. And my very favorite, even though it's probably the most strenuous, is the Thai rock climb. What you're doing is climbing up a mountain path, and not only are you sidestepping, but along the path, there are rope ladders. And in order to climb a ladder, you reach your arms up and you just keep moving. My kids saw me exercising, and they wanted to try it. And they were laughing, and it comes with a lot of giggles anyway. Initially, when I first started it, I had to hold on to a chair. But I found that repeatedly doing the exercise, I got confidence in letting go of the chair. So right now I do it freestanding. Bottom line, I'm sold on it.
So I love Paul's testimonial because he is proving that you can reverse muscle atrophy. You know, when he first started the program, he had to balance himself, and now he's doing it freestanding. Now, Remote Care Today is going to provide all the patient education materials that are needed to educate your pharmacies about the program. So you'll have posters and signage available. They're even working with a prescription bag manufacturer where they'll actually do the printing right on the bag. They'll set you up with your own landing page. So it's like your own website that you just direct patients to, or the information on the bag has that QR code. When they scan that, it takes them to your landing page. And there will be testimonials like Paul's and other patients on there talking about their success with the program, and they'll get all the details needed in order to get started. They also will help you do a little script so that you can welcome patients. So you're going to have a familiar face there that your patients recognize, whether that's you or one of your techs that everybody knows and loves. You know, you can have them do the little welcome message on there. Now, when the patient completes a full month of their exercises, there is a opportunity for you to do an administrative review. These reviews shouldn't take you more than about a minute per patient. This 30 seconds video here will show you what you do.
Working with our program is easy for you and your staff. If you choose to review your patient's monthly progress and earn administrative services fees, you will be sent a weekly email notification reminding you to log into your portal and review patient assessments. You or an appropriate member of your staff will review these reports, review the summary data for the patient, add your notes, and then simply click the sign-off box next to the record. It's that easy, and it's that fast.
So again, about a minute per review. In this example here on the right-hand side, if you had 100 patients on the program, this is a PMPM or per patient per month that you are eligible for $25 per patient. So 100 patients would be less than 2 hours worth of reviews, and that would pay you, over, it would be 2,500 or you know, 1250 per hour. So not a bad return on your time investment there. So, when you're ready to get started, you simply can run a bin analysis report out of your pharmacy system, identify the patients that would be eligible. And even though we're really focused on this program for the 65 and older, it is a musculoskeletal program. So there may be patients that would qualify that aren't 65 if they are rehabbing from an injury, or they have an early onset of arthritis or something like that. They may also qualify for it. But it's easy to identify your 65 and older patients. So an amazing program, again, zero startup cost, and that was step one in the clinical services that you can offer. Step two is the independent pharmacy provider network. These four pillars right here are the pillars for success. They're also the pillars for failure if not done right. If you don't have the proper turnkey software patient engagement system in place, you can spin your wheels and fail at this program. What I love about this program is it is really a win-win-win. The patient wins because they have easier, faster access to care by going to a community pharmacy. And they don't have to wait around for a week or a month to get in to see their primary care provider. Well, the primary care providers still win because they're still managing the care plan for that patient and getting compensated for it. Plus, this is filling the care gaps that they don't have time to get to, which improves their quality measurement scores. And if their quality measurement scores go up for the doctors, their reimbursements go up. So the doctor wins. But the pharmacy wins the most in this program because approximately 67% of all the bill charges stay with the pharmacy. Here's just some examples of the CPT codes that you can offer. The preventative health visits are the 99391 through 99397 codes. You've got the office visit codes. But I want to point out at the top here the continuous glucose monitoring, CGM program. That nets your pharmacy $25.95 per year per patient on a continuous glucose monitor. These are opportunities that community pharmacies are, out of the goodness of their heart, are helping patients set up their monitors, but not getting compensated for it. In the IPPN network, you get compensated. In fact, the sensor placement and testing in month one is $596 reimbursement, the CPT code there, 95249. And then every subsequent month after that is approximately $298 per patient per month. So you put 100 patients on a continuous glucose monitoring program with your pharmacy, that is real dollars. That's $250,000 to your pharmacy just in that one program. There are actually 3 PMPM programs, one of them being Remote Therapeutic Monitoring, which we just covered, continuous glucose monitoring, one other program. Those 3 PMPM programs will generate over $300,000 per 100 patients per year. So we wanted to make sure that community pharmacies were aware of these tremendous opportunities. And you have now consultants that will work with you to help you get those 100 patients per program on. I don't know how many times I hear 10 or 12 times a day talking to community pharmacies all over the country that had signed up for programs, had good intention to do something with that program, and they just haven't done anything with it. How many of you on this call are a part of Outcomes or CPSN? But what have you done with it? And most pharmacies tell me, yeah, we signed up, but we just really haven't done anything with it. Well, consultants will actually help you follow through and get these patients engaged so that they have better outcomes, better patient outcomes, and it can help your pharmacy as well. Step 3 in the clinical services was the BRIM wellness program. BRIM, you own the clinic. It's your clinic. You name it whatever you want. BRIM is just like the Intel inside. It's powered by BRIM. And the three-legged stool here is the managed services, the helping you set up the clinic, get the equipment in that's needed, the build out of everything. Most states require that you have a hand washing station either in the clinical room or just down the hall from it. So you've got to make sure you've got the proper access. That's leg one. The second leg of the stool is the talent exchange. You'll be able to bring in services that like lab services right there in your pharmacy. While patients wait, they can get their lab results. Well, a lot of those labs require a phlebotomist. Most pharmacies don't have a phlebotomist on staff, so you can use the talent exchange. You set up your lab day as Thursdays, you post the shift, and a phlebotomist comes and fills that shift. So imagine it's kind of like Uber, but for medical staff. If you have amniotic wound grafts for diabetic lesions that need to be placed, you post that shift. You need a nurse practitioner for that. So then a nurse practitioner comes in on that day. So that's a tremendous opportunity that keeps your costs down, where you don't have to have an FTE, a really expensive FTE. You only bring them in when you need them. And then the third leg of the stool is probably what I'm most excited about, because that's the financial vehicle. Not only can you borrow from the pharmacy fund to set up your clinic, when you pay back that pharmacy fund, you become a cooperative member of the fund, which now allows you to help the next community pharmacy get their clinic set up. And now you're earning interest on that fund. Some point in time, you want to retire. You want to hand your pharmacy down to the next generation of community pharmacies, and the pharmacy fund can be part of your retirement, because that just goes on and just continues to grow and build over time. Now, the very last thing I want to share with you is the RxDirectCare. This is transforming your pharmacy into a same day, urgent care hub. It's all the things that you're already doing out of the kindness of your heart, but now you can get compensated for that. I don't know how many times a day you have somebody come in and they've got a strange rash on their arm, and they want advice of what would be a good, topical for that, or if they need antihistamine. Maybe they've got a scratchy throat. At least 10 or 12 times a day, you've got patients coming in wanting help with something. Pharmacy is the only healthcare industry that I know of that's expected to give away your time for free. Well, that stops today. We want you to get compensated for those consults, and this happens through the Direct Care. It is a private payer. Every pharmacy should be in network to accept this program. It's kind of like affordable concierge medicine, so that anytime a patient does come in and they have those little things that they need you to consult with, you get compensated for that. $40 per patient engagement through RxDirectCare. So I'll leave some additional information in the show notes for that as well. So that is our program today. I know it was a lot of information, so that's why we record this, and we'll make the recording available to you so that you can go back through. In the show notes, I'll even put information on how to contact any of the services that were discussed today. If a consultant has invited you on today, you can get back with your consultant to also take the next steps. And again, there are a very clear roadmap for you to be able to be successful in clinical services today, so you don't have to spend your wills and spend thousands of dollars and not get across the finish line. There is a clear path on how to do that, and we're here to help you. So thank you so much for taking time out of your busy schedule to listen to this program today. Again, my name is Breck Rice. I absolutely love community pharmacies, and I'll do everything I can to help you be more profitable.